So my patient lost their sensation on their feet, so that causing a lot of issues. So they didn't understanding, like they put their feet on and they scratch it. So that's why patients who has diabetics, they should make sure they follow with the pediatric. So, and also they are really high risk to get a fungal on their toenails, on their nails. So sometimes even in the diabetics patients, they have to make sure like or it's so in those kind of patient also sometimes blood clotting has an issue. So that's why they have to be on a track with the doctors if they want to cutting their nails or they wanted to like doing these things. Another things we have to make sure patient have good education to how they checking their sugars, which means how to use a glucometer. Make sure as a physician, as a provider, we as a provider in the future, we order the glucometer for the patient so they can have a track on their blood sugar, and also make sure we teach them properly how to check it to prevent infection, because sometimes people reuse their needles or people didn't clean it really good their fingers. So it is important to first of all order that one, second of all make sure patient have enough education to use that one. And also we want to make sure we have a good education for the patient. If they are pre-diabetics, it's important to teach the patients to say, hey, like this is important, why the diabetics is bad, why what kind of risk factor they might be having in the future. They might be lost their eyes vision, they might be have a wounds, chronic pains, or a lot of issue. In some cases also it can be a good idea to order statin medication like atorvastatin, pravastatin, because sometimes high cholesterol also can turn it to the sugar and make it the blood sugars goes high. So it is important to give the proper medication to the patient who has diabetes. Another things it's really important, we have to discuss it with the patient, is what is the plan of them, how they want to manage this one if they have diabetics, how to want to decrease it. So one of the good referral for these kind of patient is referral them to the nutritionist. So nutritionist can help them to educate them what proper food they can use it, what they can substitute instead of like high carb, high sugar, like what they can eat instead, or what kind of food it's gonna be help them to feeling less hunger. Because usually in the diabetic patient, they most of the time they feeling hunger, and that hunger make them to eat, and that eating make them sugar goes high. So nutritionist can be a good option for this kind of patients to so make sure like how they eating, how following the diet. Also make sure to educate the patient they have good hydration, drinking so much, make sure they know what kind of like even in sometimes they needed to know what kind of water they have to eat it. So sometimes mineral water work, sometimes regular water work. So this is the information nutritionist or even follow up with their primary doctor can be help to the patient so they can have the better assistance regarding that. So these days, as I mentioned, those machines, they have a new technology coming. So which is the glucometers. The patients doesn't need it. Sometimes the insurance cover it. So patient doesn't need it to poke themselves every day. So they already have the machine, which is the connected with either their phones or in some small monitoring. They can have some pin either under their elbow or under their on one of the quadrant in the belly part. So that's regularly every hour. It depends on what is the provider's order. They checking their sugar. So that's way patient can understanding like they are hyperglycemic or hypoglycemic. We know in a patient who has the diabetics, hypoglycemic is one of the dangerous things because it is important so they are not hypoglycemic, because hypoglycemic can make it a shock on the patient and have further problem. So this is important on the diabetic patient. We have a proper education. So what is their expectation, what they have to see it, what we have to make sure they have education, what they don't know about this problem. So this is one of the important. So another thing is we have to educate the patient to have a more physical activity, which is exercise, aerobic. We want to ask the patients to start it slowly, because sometimes, as we mentioned, diabetics happen because they are doesn't have the active life. So we don't want to too pushy for the patient, so we're gonna be asked the patient is slow by slow starting to have exercise. We can just like offer them some gyms, we going to the gyms, or like starting with a slow walk like 15 minutes a day around their house, and then increase it week by week. That way their body get used to it, to the activity. We also explain it for them why this activity important, because this activity make it their muscle to use more blood sugar in their like blood streams, and that helping them to decrease their sugar. In the meantime, we also have to make sure we tell to the patients, hey, so even you're doing this, you have to make sure you're not getting hypoglycemic, because as I mentioned, since the patients on either in a medication or an insulin, they are in a higher risk to their blood sugar dropping down really fast. So another things it's really important to tell to the patients is they have to always carrying a small snacks or a small sugar candies. So these sugar candies help them to like controlling their blood sugars, like make sure they helping, and also they are on a track for that. So also we wanted to make sure we talk to the patient they never forgot their insulin, their medications. So we can educate them, they can put the alarm on their phone. We can ask them if they have a caregiver, the caregiver help them to like have their like remind them. Also we wanted to follow up with them. So this is another important is to make sure patients is on a track, which means we want to make sure patient have a follow-up, patients see the doctors regularly, nutritionist regularly. Also as a primary provider, we wanted to see what's going on. We wanted to be on a track, order the labs on time, ask them to come into the office. Even they cannot come in, do the telehealth to follow up with them, make sure they getting they understanding, they getting enough education. So education is always is the main part in any diseases. Diabetics, as I mentioned, is one of the diseases which seems people don't know how to control it. They don't know that the main part is the foods. So sometimes they even don't know what kind of food they can use it to make them their control their hunger, and also controlling their blood sugars. So another thing is psychological supporting the patients, which means we want to make sure patient is not in a depression, doesn't have psychiatric problem. Sometimes in some patient who has depression, they are overeating. Those overeating make their sugars goes high, make it they turn to be diabetic. So first of all, we screening for any depression. If they have depression, so we have to right away either referral them to the psychiatric or consulting to make it that problem goes away, and then that will help to the diabetics goes away. But sometimes people get depression because they find out they have the diseases. So we as a provider, we are have this responsibility to make sure patient understanding and support them psychology. Also, we can have meeting with their family or caregiver to teach them how to support the patients, and ask them what is going to be help to the patient to having feeling better, or what make them happy, or how they can deal with the new situation. Because in when they are in a diabetic, so this is a life changing, so everything is changed. So sometimes this gonna be affected psychologically in the patients. So another things is we have to teach to the patient they might be have some body change. What is that? Like maybe they have edema, maybe they feel fatigue, maybe if sleep and this trouble. So all of this we all want to ask the patient, if you see it, call us. If you see it, come to the office. If something's like really sudden happen, if we are not available, go to the emergency. This is the information we have to give it to the patient who has diabetics. So in my presentation, my whole point is we learning about what is diabetics, why people getting, what is the reason people getting, how we can control it. We know the baseline with the simple words. And also my point in the whole video is it is important always prevention than treatment. But if it's happened and out of the hand, so it's make sure we have a good and enough education to the patient so they know how to deal with the situation. So to how help them. And this, as I said, as the future provider, my personal goal is, if I have this kind of patient, make sure educate them. Providing resources also is important. Make sure I understand they learn it, and also handing them their notes. So hopefully my presentation give you enough information. Please feel free to ask me if you have any question, put under my video, and I would love to happy to answer all of your questions. Thank you so much for watching my presentation. Appreciate it.